What is high blood pressure and how can we treat it without medications? That's today's topic. My name is Dr. Noha Polack. I'm a pediatrician at Progressive Pediatrics, where I've been practicing since 1996. And today I'm joined with Dr. Samir Khalil. Dr. Khalil?
Yes, good morning, everyone. My name is Samir Khalil. I'm a family medicine physician. I'm board certified in family medicine and obesity medicine, and I've been practicing for the last 5 years.
Wonderful. So, Dr. Khalil, in pediatrics, high blood pressure is not a big thing. However, sometimes we do find high blood pressure in children, and it's often what's called white coat syndrome. They come see the white coat, they see us, and they get so scared that their blood pressure goes up. So we tend to measure it at two or three visits in order to tell if it's high blood pressure. But I think it's different in adults. Is that right?
Absolutely. You are absolutely correct. So now I want to start off with a common question that I have is what's the number? What's high blood pressure? So I would say, in generally speaking, whenever your physician or provider will speak about blood pressure, they're going to give you two numbers, top and a lower number. What's considered normal is if the top number is less than 119 and the lower number is less than 79. We have a little middle range where if the top number is between 119 and 129, that's considered elevated but not truly high. And then anything above 130 is really considered high. Right now, as far as, let's say, the measurements, or when can we say you definitely have it, or how does it know to be diagnosed, you really never want to jump to conclusion or jump to a diagnosis based on one reading. So the way I usually ask my patients to do is to record their blood pressure at home in their natural element, in their comfort zone, twice a day. This is more reflective of where it naturally and actually is versus the office. And then we visit back in 2 weeks, we compare the readings and we see. If the readings have been mostly elevated at home, then at that point we conclude our blood pressure is probably running a little high, and what do we need to do about it? If it's perfectly normal, then again, it could be something along the lines of white coat syndrome or a little anxiety from the office, or many different elements that can play a role.
Okay, great. So what can patients do to help lower their blood pressure without taking medications?
Sure. So a lot of things we discuss is really, what are we eating on a daily basis? What kind of diet are we following? Healthy eating is really the cornerstone of most treatment, or the treatment of most of these conditions that we commonly face, whether it's high blood pressure, whether it's elevated sugar, whether it's elevated cholesterol. So we really dive into with our patients of how are we eating, what are we eating on a daily basis. Other issues as well is lifestyle in general from an activity perspective. Is our lifestyle active? Is it sedentary? Are we exercising? Are we not? Another topic we usually discuss, and it's very crucial as well, is stressors. Are we generally stressed? Are we sleeping well or not? Also, it plays a huge role. Unfortunately, sometimes, you would find that if someone's stress level is very high, affecting their sleep, it is very common to find that the blood pressure will be elevated as well. So something we discuss. The last 2 points that we should dive into with our patients are also alcohol intake, their drinking, and whether they smoke or not.
Understood. So for kids, I usually recommend that they go at least for a walk a day. They don't have to go to the gym to lower their risk of either high blood pressure, diabetes, being overweight. So would you recommend going for a walk, or is there something more specific that you would consider exercise?
So I would say, Dr. Polack, in the last few years, there's been a lot of research and science done about exercising and best exercising practices. And I think the one thing we're learning in general is staying active versus not staying active. It's really the key point. Working out in the gym, exercising outdoors, a lot of it has shown to be beneficial, despite really the regimen. So I didn't want the patients to feel like they're obligated to stick to a certain regimen or a certain method of being active. Let's just be active. And that's what's been shown consistently to be more beneficial and healthy than inactive. So if you enjoy walks and you feel like you're going to stick to taking these walks, please go ahead. If you enjoy a certain type of sports, please engage in it. It's really what is the patient's preference that makes them more likely to continue with this activity, rather than feeling this is an obligation, this is something I might do.
Perfect. That's exactly what I thought. So if you need to find us, I am at progressivepediatrics.com. And Dr. Khalil, where can patients find you?
I'm at www.advocarePanoramamedical.com.
Perfect.
And we're currently working at a Clifton, and hopefully in December, we'll be working at a Union City.
Very well. Have a great day, everyone.
Thank you. Thank you, Dr. Polack.
Thank you.